Coming up next, Business Report producer David Weir explores the business behind medicine involving a new breakthrough treating breast cancer, pioneered by West Palm Beach physician Dr. Robert Gardner. Dave asked Dr. Gardner what the new innovation was all about.
The newest innovation that we've had just within the last year here in South Florida is breast cancer treatment in a day.
Wow.
It is a wow.
Yeah.
And it's a wow because for selected women who have breast cancer, they can come in, have the cancer removed, have 2 minutes of radiation therapy while the breast is still open, have the breast reformed, a lymph node nearby sampled, and they can be back home in their bed that night.
Well, doctor, that's terrific.
It is an amazing...
Yeah, it's amazing.
It's amazing.
Considering...
Yes, sir.
Well, you know, the actress Angelina Jolie highly publicized double mastectomy when there was no cancer detected. What's your comment on something like that?
Again, where the woman selects to have it done because she's at high risk for breast cancer or has the breast cancer gene, that is a marvelous choice for her.
Right.
It means we go in and we remove the inside of the breast and then reconstruct with a plastic and reconstructive surgeon the same day. So when she wakes up, she still has her breasts, but she's missing the inside where the cancer would develop.
I got you. So it's not as drastic as we might imagine, right?
Not from her perspective.
Yeah,
she's asleep for about 6 hours or so, and she wakes up with the operation done. Okay. So it's amazing.
You know, another highly controversial situation in relation to breast cancer is mammographies. You know, somebody says, what's your comment on how this should be handled?
It has taken us about 30 years to get to the point now where we can screen with mammography. And we have the United States Preventive Services Task Force making recommendations that women aged 50 to 74 be screened every 2 years.
Right.
With the contention that some of the cancers that develop are indolent or are not cancers that will cause the woman to die, so why hurry up and screen every year? The answer is because if you don't screen to find out that there's a cancer there, then you can't biopsy, and then you don't know who has a cancer that will kill them and who has a cancer that can be treated in a different way. It's not right. It's not right.
Well, you know, I lost my tennis partner, who was a wonderful lady, and she had a double mastectomy, and 7 years later, it came back virulently and killed her within 2 or 3 months. How does that happen?
Detection not early enough, David. That's the whole point of mammography and women's self-awareness about their breasts. Mammography can detect the beginning of a cancer before it gets to spread.
Right.
It doesn't necessarily help the woman to go and take off the breast when the cancer's already spread. So the secret to prevention of death from breast cancer is early detection.
How is that done with a woman? Is it through self-examination or the mammography deal?
Both. We now talk about breast awareness. We ask a woman, look, if you feel, see, or sense a change in your breast between your regularly scheduled visits, please come find someone to help you evaluate your breast. Secondly, based on 40 years of experience in the field,
right,
annual mammography for women age 40 up to at least their late 70s, in my opinion, is not only the right thing to do for women, it's cost-effective for our society. It saves lives and it saves ladies' breasts.
Doctor, is there any age situation for women that this happens more than not?
The numbers go right up to be high into the mid-80s. So if you look at how many women per 100,000 get breast cancer in their 40s, it's here, 50s here, 70s here, 80s here.
Yeah.
And so the incidence keeps growing as the age goes.
Right.
And we believe that's because whatever the causative factors are, they have been at work for all those extra decades. So we believe women who, even in their 80s, should continue to have examinations and screening mammography and ultrasound of the breast.
One last question, doctor. What causes breast cancer? How does the cancer get into the breast rather than any place else?
It is there because the breast is designed to make milk, and it filters out toxins that come to it through the environment, for example, through the bloodstream, through the breathing. But those toxins get in the breast, and over time they cause the cells to start multiplying, and then cancer happens.
I got you.
And the greater the industrialization or toxicity in the environment, the greater the incidence of breast cancer. So leading a good, clean, clear life is one of the best things you can do, plus awareness, self-awareness.
Yes. All right. Listen, Dr. Robert Gardner, God bless you. Thanks for being here in South Florida. Thanks for looking after all of our beautiful women in South Florida.
Well, you're welcome, and thank you for giving me the chance to share these ideas with some of our ladies here in South Florida.
Thanks again, Doctor.
Thank you, sir.